So this is TC, and TC is, hey Deb, what's his title? What did he win?
A bunch of agility titles. He has many AKC titles. He's on his way to his mark.
All right, so we have a busy, active little doggy here who is in today for a chiropractic adjustment. Primarily, Deb, because you just thought he was a little off in the table, right? He didn't.
Yes.
He didn't want to get onto the table. Or he didn't
get on the table.
Okay. So we have Dr. Hannah, who is a animal chiropractor, and she's right now just doing a simple palpation assessment of his muscles, which helps to determine if there is balance from one side to the other. Do we have muscles that are wasting a little on one side versus overdeveloped on another? And that helps us to determine if he's actually using right side, left side equally. You're also going to see her doing a little bit of range of motion. Again, determining what we have for flexion and extension in hip. Perhaps you'll see some knee. Perhaps you'll see some what we would know as humans to be ankles. Now, animal chiropractic is not going to look anything like what most of us are used to for human chiropractic. And most of you for human chiropractic are a little hesitant sometimes because you have this vision of it being this jarring, cracking. Deb, you can't see her in the frame, but she's nodding her head. I'm going to see if we can get Deb's head in the frame. This violent adjustment, which all human chiropractors will tell you, and I can attest to, it is not true. Chiropractic can be very gentle. But with animals, you will never see any of that sudden jarring movement. In fact, in most cases, you're not going to hear, unlike with humans, you're not going to hear the actual adjustment. So it's what you can't see on video, but what is happening. And if you look at Dr. Hannah's left hand, I'm backwards, her thumb is actually going in toward the vertebra. And it's just, is it an inward and then? Can you describe that for us?
It's, I'm applying a gentle pressure into the joint, bringing the joint to its range of motion, to the end of its range of motion. And if the joint moves in a direction either away or towards my hand that isn't smooth or doesn't feel quite like it should, then that's where an adjustment, there's a subluxation there. Adjusted.
And the adjustment is accomplished with just a thrusting motion with your thumb. Does that sound accurate?
Yeah, so it's through my hand and my arm, and it's a quick application of force in a very specific direction into the joint. So it's a quick, little bit of pressure. A little bit of pressure.
So for an animal, it probably is, I mean, as far as not from a sensation field, but from what we're talking about, from what we would see as a human from an observation standpoint, is it really just looks like she's pushing her thumb downward, upward, not upward, forwards, inwards, to make that minor adjustment.
That was it, that little quick.
Okay. And you can see from TC here that this is not painful for them. Not to say that if an animal had something really acute going on, that there may be some response from them indicating that they had a sensation of maybe minor discomfort. He doesn't have an acute condition. There's no injury or post-surgery here. There's just an imbalance. Deb, there was an injury, right? There was never injury yet.
Never an injury.
So we're basically doing more of a, this is, I don't want to say exploratory. He's not in maintenance mode yet. This is only his second adjustment after Deb has sort of discovered that, there was a hesitation to work the table in the agility course. And Dr. Hannah and I have done some observation with him with Cavaletti rails, which is basically we're having him walk over an obstacle so we can see how he uses, what his gait looks like. And we were detecting some swing on his his rear left leg. As he was stepping over the obstacle, he'd swing it out, not allowing full flexion of his knee. So that is, again, something that we're all working with collectively. I was helping Deb with doing a little bit of a canine fitness training from a strength and postural standpoint. And Dr. Hannah is doing the chiropractic adjustment so that if there is some kind of an actual nervous system disconnect, or if there's a soft tissue related to structural issue going on, that's where we're going to attempt to make that correction with him. And I say with him because the great thing about animals and their receiving the chiropractic or acupuncture or massage or any of those body therapies is that they really do work with us. They don't have resistance to it other than if there's discomfort, because they don't try to understand it. They don't try to rationalize it. They're just receiving it. Is that right, TC? And you can see that Dr. Hannah is working her way up his spine, just searching out those subluxations. And if you have no idea what a subluxation is, we're going to blog about it shortly. Ooh, he's liking that area. You can see he's not fighting her. This is because he knows this is helping him out. TC is also receiving acupuncture as well. So that is a glimpse into adjustment on a dog. And we're going to let Dr. Hannah continue her thing, and we will get you more video when we do something new and different that is going to be good for your knowledge.